210. Hello, good morning everyone. Good day to everybody around the world. This is I think, going to be an interesting discussion on the resilience of tourism in the current circumstances. We have had good news recently because of the announcement relating to the virus vaccine, but we are still left in a situation in which certainly between now and February, we will be in a real difficult spot. And so what I want to do in this session is, first of all, to give you a slight context of what we're trying to do. Travel, of course, has been a major factor in accelerating the transmission of the virus around the world. But at the same time, the travel and tourism sector has been one of the principal victims of the virus. Now, a swift recovery from setbacks has given the travel and tourism sector the deserved reputation for resilience. Question is, can we demonstrate that same resilience now? We've taken responsibility for those recoveries in the past, and we have to take responsibility for recovery from this setback. We've assembled an excellent panel to help us explore what is being done to combat the virus and what needs to be done to give consumers confidence to travel and residents in receiving destinations the confidence that no one is importing the virus. I'm reminded of the travel industry's response to the threat of international tourism. It required taking responsibility for the systematic implementation of integrated safety and security systems, all of which was expensive and inconvenient, but is now accepted custom and practice to provide passengers and staff with the confidence that they are unlikely to be blown up. Do we need to do the same to combat COVID-19? So let us start with Inga Houtbrits from the Radisson Hotel Group that has 1,400 hotels worldwide. Now, first of all, Inga, welcome. What have you done to ensure that you are COVID secure and customers can have the confidence to visit?
Yeah, thank you, Martin, and good morning to everyone. Well, early on, this is quite a year, actually, for everyone, I think, in tourism. And quite early on, when we started to think about reopening the hotels that had previously been closed in the beginning of the year due to the lockdowns, we defined a protocol for safe reopening of the hotels, and we called it the Radisson Hotel Safety Protocol. It's actually a 20-step protocol for the overall operations, complemented with a 10-step protocol specifically for meetings and events. And what is unique in our case is that to ensure a rapid rollout, because rolling out something like this across 115 countries, 1,400 hotels, train everybody, we needed to make sure that we could give that reassurance to our clients that we're actually doing what we say we are doing. And we are doing that through a validation process with a company called SGS. They're one of the biggest health and safety auditors and inspectors worldwide. So they actually help us to assure and validate that our hotels are actually doing what we say they are doing, namely implementing the Radisson Hotel Safety Protocol. So that's the key of what we are doing. And I must say that early on also, we initiated and we participated in the conversations about setting the guidelines for the industry. So we were part of the group, both in WTTC and in AHLA, that defined for the US market, but also for global destinations, on one hand, the safe stay and the safe travel. So we also helped create this overall framework that should help give the confidence to travelers to go and visit certain destinations again. And then the third pillar, which we are still doing very much so, is to evaluate all the new technologies. So we have started a very focused group on innovation, where we evaluate technological innovations, but also service innovations like hybrid rooms, etc., And we even launched a new brand in the meantime. So we've been busy, but like everyone else.
What about this question of communicating to customers to give them confidence in what you are doing?
Yes, that's a very excellent question, because it's hard for consumers to know where it's safe to travel. So therefore, what we have done with our Radisson Hotel Safety Protocol is to very transparently indicate what these 20 and 10 steps are. So you can find them in our hotels when you enter. You can find them in a kind of safety card like you have in an airplane. We also communicate those pre-arrival. We of course communicate them on our website. And we have visible signs in the hotel. First of all, if a hotel can use the Radisson Hotel Safety Protocol, you will also see the SGS logo with a QR code where the guest can scan and they can see when the hotel has been inspected. The other thing is that we have visible signs when the guest, it's very important to the guests that these things are very visible. So for example, you will see the plexiglass screens when you come to the front desk. You will see the physical distancing markers on the floor. You will see, when you come to your room, you will see a door hanger to indicate which high frequent touch points have been cleaned and when your room was disinfected. When you come into your room, you will find an additional amenity, namely a hand sanitizer and some masks on the table or the bedside table. You will also see that the remote control of the TV, which is one of the most touched items in a guest room, is actually disinfected, and as proof of that disinfection, it has been placed in a sealed bag, also with a sticker on it. So there's visible signs throughout the guest experience to make it easy for the guests to see and to give that confidence that we are applying all those steps of the safety protocol.
Inga, you I think have said to me that you operate in 115 different countries, but all the different, so you are having consistency as far as the hotel is concerned, but of course you're having to confront the fact that all these different countries have very different arrangements and restrictions and so on, and it's a question of how you cope with those. Can you briefly explain how you manage to deal with those things?
Well, of course, as a global hotel company and in any area, whether it's the COVID prevention or any other area, we always have to follow the local guidelines and regulations as a minimum. But I would say our Radisson Hotel Safety Protocol actually goes beyond that in many locations. So of course, for example, today in Belgium, the hotels that are still open, we are close to a lockdown. For example, the fitness and the restaurants cannot open. We have protocol elements for the restaurants and the fitness, but of course, if the government says that those need to be closed, then we close them. We always follow the local guidelines. But the Radisson Hotel Safety Protocol has provided us with an excellent standard that we apply across our hotels. And that was needed because when you have, even in China, where our business has recovered, we are still fully applying the Radisson Hotel Safety Protocol, which means, for example, that our team members are still wearing face masks. They're wearing their personal protective equipment, even though the market has recovered. When in Sweden in the summer, and still the guidelines were, for example, much more relaxed than we see in other countries in Europe, we insisted that our team members continue to wear the face masks. And sometimes we were even the exception in the market. But for us, it was very important, and it still is, to maintain that consistency on the protocol that we have defined.
Very, very interesting. Now, one of the other things which is certainly, as far as the customer is concerned, is making a booking and being encouraged to make the booking and worrying about, as they come nearer and nearer to their departure to come to your hotels, the cancellation policies. Have you changed your cancellation policies within that framework?
Absolutely, we have. And also very early on, when we all thought that this would be over in a few months, let's say. So I was already in March or even in February when we issued our first updated cancellation policy. And that was, of course, to give reassurance at a time when hotels were closing. Now, today, we still have about 80 hotels closed worldwide. but this cancellation policy has been extended now till the end of the year. And honestly, I expect that we will be extending it further, because we see that the virus and the pandemic is still amongst us. And the basic pillars of that cancellation policy, both towards individual reservations and leisure groups, is to give free modification and free cancellation. So those have been the elements recurring with all the details that you need to provide. It's all on our website, but those are the essential elements of the cancellation policy.
And finally, before we pass on to the next panelist, I wonder if you are obviously looking after hotels, but what are the things that you would like to see briefly from other areas of the travel experience that you think would be helpful?
Well, as I mentioned, I think industry needs to stand together, because we're all in this together. The destinations, the airline companies, the hotel companies, the other travel companies, we're all in this together. So that's why I think it's very important that the industry works together like we did in the beginning when we defined the safety protocols, also in collaboration with WTTC and AHLA. On a global scale, I think it's important that governments align better. It's part of the manifesto that was discussed yesterday at the Ministerial Summit. It's important that governments align better on travel restrictions. It's so confusing for the consumer to know how everything is evolving. So whether it is in certain corridors in Southeast Asia or whether it is globally, which is quite a project, but we think that that should happen, and we support the position of the manifesto in that. I also think, and I'm not alone in this, that the future will come also from rapid testing. The airlines are already demonstrating this. This is certainly something that we see now being used by governments, but know that the space of rapid testing will evolve quickly. So we see this at Radisson as a way to, for example, keep a meeting or an event safe. If you can test everybody, you can create that safety bubble. And why not think possibly about creating the whole hotel as a safety bubble, or a whole airplane as a safety bubble? And it's already being implemented by certain airlines. But what is important there is that, again, we share experience, we share best practices in the industry, and that the governments allow us to use such a test by businesses, because in some countries today, there are heavy regulations on how to use such tests, and we don't want to see that, of course, because this will enable travel to come back.
Okay, thank you very much. You've done wonderfully well, thank you. And a perfect entry for Jeff Poole from WTTC. Now, Jeff, at WTTC, you set out protocols for travel and tourism in May. How have things changed since then? How have you modified or developed your approach?
Thank you, and thank you for allowing me the opportunity to speak on behalf of WTTC. I think the answer to your question, Martin, is that things have changed dramatically. When we first became aware of COVID-19, people were clearly concerned at the hygiene and safety aspect, which is why we quickly developed this series of 17 different protocols for different parts of the travel and tourism industry and pushed those out widely. And they're now in operation in 185 destinations around the world. But the world has moved on from then. And I think every sentiment survey that we do of consumers and that other people do are showing that actually the hygiene and safety issues are relatively low in their concerns. What is missing is the certainty of being able to travel, whether that's because of the confusing mix of rules and regulations that Inga was talking about, or whether it's rapid changes in government policies, such that you can go to a destination feeling confident, but then suddenly get stuck in quarantine there. So it's that uncertainty that is undermining traveller confidence. So we've been working with governments to do two things. One is to try to remove the barriers to travel, remove quarantines, ensure that air corridors are opened, and most importantly, get an international agreement around testing. Everything in terms of reopening travel and tourism starts with testing, testing, testing. And it's not only to allow international travel to reopen safely, but also to give the traveller that confidence again. And I think it's really important to understand that a combination of the testing with the protocols, wearing masks and so on, are absolutely fundamental and make travel and tourism safe again. It's really interesting. There was a recent report by the Harvard School of Public Health that pointed out that actually when people go on their journey and they're in an aircraft and they get to the other end, because there's so much attention paid to the hygiene and safety aspects and the protocols, that people are actually safer in that environment than they are in their local supermarket or restaurant. Now that's a technical reality, but of course you've got to persuade the traveling public of that. And that's why we're so keen to get these air corridors and other things up and running, because then we can demonstrate clearly to people that travel and tourism is safe, and you know you don't catch COVID-19 when you're on an aircraft or a cruise ship or something else like that. You're in fact at arguably no higher risk, probably a lower risk.
Yeah, can I just explore a little bit? For example, you mentioned, just like Inga did, testing. Now, the point about testing of the original kind with swabs and length of time it took to get them to fly and so on, whether you had it or not, was that they were very slow, very expensive, rather uncomfortable to apply. And the new ones, which are beginning to emerge, I mean, I know of one which is not yet emerged, but is at Porton Down at the moment under testing, which is a saliva test, which gets the results back between 5 and 10 minutes. It'll cost anything, depending on the volume used, will be something along the lines of less than £10, probably nearer £5. Now, my thinking behind that, and it'd be interesting to hear what you and others have to say about this, is that if you had a test like this, which was you were applied, let's say, took 72 hours or 5 days or whatever the number of days before, and on the day of departure, you could then pretty well guarantee that nobody in the airport and nobody on the aircraft actually had the virus. And that would help give people confidence. So that, and of course, you want the same reciprocal arrangements operating the other end. Now, my thing about responsibility for taking responsibility is that we have so far thought of government always paying for this. And I'm wondering whether in this current situation with travel, which after all is discretionary, we shouldn't actually have a system which is integrated, and this is the question I want to put to you, is integrated so that it's applied, as it were, on the ticket. And so you have the testing, and you can go to your pharmacy and get it done and see what happens next. But that means to say that it is included in the cost of the ticket. Now, is that because if we look at it long term, we've got to have an arrangement for infectious diseases, which is just a system which becomes normal, like the one we've used for, as I gave you as an example at the start, relating to terrorism. So I'm just wondering whether that aspect of it is one which has been considered in WTTC, and you, of course, with your background in aviation.
Yeah, absolutely. I mean, and I think it's really important to understand that COVID-19 has a very specific profile of when people are infectious, when they show the symptoms, whether they're symptomatic or asymptomatic. And that says that if you take and then you also got into that, the effectiveness and reliability of different types of tests, and those factors play into each other. So just because you have a test one day doesn't mean that you're not infectious. You have a negative test may mean that you're infectious, you're not showing it. And so you really need to have several tests along the process. So what you were saying, Martin, about a test before you go, a test on departure, a quick and rapid test, and they're quickly becoming that fast evolving technology now. Cheap, efficient, effective tests are going to be available for people to take on departure, and you can see those coming into play in a number of places in the world. But then to make your point, at least people on the aircraft will not be, even if they're infectious, even if they're carrying COVID-19, they're not in the infectious stage. So everybody on the aircraft is safe. But then you probably need a test perhaps 5 days after arrival to see if somebody has COVID or not. And that's where a lot of work in the International Civil Aviation Organization is pointing. It's to actually say, well, you don't need a 14-day quarantine if you can test people after, say, 3 to 5 days after arrival. And if they're negative at that point, then they can be released from quarantine. And this is really, really important, because it's quarantine that's killing travel and tourism, and therefore killing any prospect of economic recovery. So we need to have testing in agreed regimes, because the problem at the moment is that this is all being looked at on a national basis. And we need to have an international framework such that if somebody has a test on departure, that's accepted when they arrive. And so you haven't got a huge, confusing bureaucracy facing the travellers and affecting traveller confidence. So, you are driving genuine safety with an efficient operational process that's not costly, and you're rebuilding traveller confidence at the same time. But we need governments to work together on it.
Yeah, is that best done on a bilateral basis then? So we'd say with the UK, with the US, that we work together to try and have reciprocal arrangements. Would that make sense?
Yeah, absolutely. And my good friend Paul Mayer will talk about Common Pass and the Common Trust framework that goes around the certification of those tests and so on. But right now, what we need to do is we need to get those air corridors opening and operational, but then we need to be collecting the medical data, because that's what we're missing at the moment. And governments will not lift quarantines until they see the data that travel is safe. But you've got to get it started, you've got to get the test results, and then you've got to demonstrate that we are capturing infectious people before they go on a journey, and therefore travel and tourism is safe, and that the methods of collecting the test results and conveying those electronically are trustworthy, and so on. So you build up that whole network.
Now, at the moment, my understanding, and I spoke to someone this morning, is that the planning in UK and across Europe is that the situation will be the peak of this virus will be somewhere in February. That's what they're planning for. They are hoping, obviously, that the actuality will be rather better than that. But when do you see, at the moment, some of these programs of mass testing within the context of travel coming into play fully? When do you see them fully operational?
There's no easy answer to that, Martin, but I think we're seeing it within weeks. I mean, it's already beginning to happen now. You see lots of testing at different airports or major airport hubs around the world already that are quick and efficient. So this is building up momentum. And it needs to happen because, frankly, part of our message to governments is they've got to move from risk avoidance of no travel and stopping coronavirus to a point where we actually learn to coexist with the virus. COVID-19 is going to be with us for a long time, even if a magical vaccine is available tomorrow. And by the way, what about we know that there's a pattern of these things. So it's not just going to be COVID-19, the point you were making. We're going to have to live in this health and safety hygienic world for probably forever going forward now. So we need to learn to live with the virus. We need to learn to start to travel again safely and effectively, build up that data, and then people's lives can be restored. I mean, that's the terrible thing. If we're closed down until March or February, the economy's gone, people's livelihoods have gone, mental health has gone, and everything's gone. And that's the terrible price that's being paid at the moment from quarantines.
Well, that's the responsibility that we all have working in this sector to try and put that. Thank you very much. Let's now move on to Malcolm Bell from Visit Cornwall. Malcolm, you are representing a destination, and you need to reassure customers that Cornwall is COVID secure, and that the arrivals are COVID free, and also when they do arrive, they behave sensibly. What have you done to ensure that Cornwall is COVID secure?
I think the first thing is to say is that we were the first tourist board in the UK to tell people not to come, and that was about a week before the lockdown, as we were picking up that actually the consumer was worried as well as the population was worried, and we felt it very important as a tourism body that we represented the views of the host community. What we did do is a lot of video about welcoming you back later. So that was one thing. What we actually did mainly during May and June, working with a number of bodies, particularly the Cornwall Public Health and Public Protection, is an awful lot of seminars and advice and guidance. And that was built on with things like Quality in Tourism's scheme, the Visit England scheme, Good to Go, as well as the AA scheme. A lot of it was actually just about spending time online on Zoom with members and with the wider industry about what they could do. And, you know, best practice for hotels, and seem to about Radisson, because most of our hotels are independent, so they haven't got that corporate support, but also self-catering, attractions, all sorts of things. A lot of innovation went on in those 8 weeks leading up to the 4th of July. And over the 3 months afterwards, and for those not in the UK, Cornwall was certainly very popular. Population of Cornwall is about 500,000, just over. We had 2 million staying visitors, staying for about 12 million bed nights, and 9 million day visitors. And the infection rate in Cornwall actually slightly reduced. We were very low, but actually it didn't increase. And I think that was partly preparation by the industry, absorbing those extra costs. I mean, lots of our members, their cleaning costs have doubled. So we managed to have a more than busy summer period, which went right into September and October. And in fact, some of our hotels were 95%, not many were 80% booked for November. The infection rate has started to come up, but there's only been 2 infections in Cornwall related to the hospitality sector, one in a pub and one in a hotel, but that was caught outside and maintained. So we certainly did stay on top of it. Obviously, there is something as we learn more about this virus, and I couldn't agree more with Jeff that we're going to have to learn to live with this. But obviously, being outside a lot and the summer conditions, even in the UK, with the odd bit of liquid sunshine, as we like to call rain, you know, it was containable, and there were an awful lot of people, and there was a lot of concern, a lot of stuff in the media about crowding in Padstow and St Ives, but no cross infections. So that's a great credit to the industry, really, of gearing up to operate safely.
The statistics suggest that people behave relatively sensibly. I mean, certainly, I've seen signs in London, and we've seen other signs across other parts of the UK and around the world, actually, where people have not behaved consistently as they should. So have you done any specific things to encourage sensible behaviour once people arrive in Cornwall?
Certainly an awful lot of messaging to visitors, particularly using digital, reinforced by businesses, obviously having the advice. You can never get everybody to behave themselves, and I have to say that applies to local population as well. There's an awful lot of day visits and beach visits. Our beaches have never been so busy, and that was mainly because the number of local people who were furloughed or working part-time or working at home flexibly. So we did have some incidents. Most of those actually were dealt with by social pressure, people tut-tutting and people mildly chastising. But there were some incidents. Luckily, they never involved any transmission of the virus. But I think that's the same in every community across the world. There are those that will push the rules and break the rules.
Are there things that you would like to see done which would help you further, or are you happy more or less with being able to manage the situation where you are?
No, there's lots. We're having lessons learned from this summer. I mean, certainly there were challenges with people coming to Cornwall who weren't used to our coasts. Maybe they've been to wonderful Barcelona and other places and down on the Med. So the RNLI were more busy than they would normally be as lifeguards. So there's actually some wider issues other than COVID, which is about safety on the cliffs and safety on the beaches. We did have challenges with litter. We did have challenges with overcrowding in certain places, and we have got to learn those lessons and implement actions in visitor management for next year.
I mean, the overcrowding, just quickly, I mean, in the COVID-19 situation, that becomes much more of a serious issue. What extra measures did you use in order to disperse those crowds or prevent them from arising?
The best measure that was taken is traffic restriction. A lot of our towns and villages in Cornwall were designed for hand carts and horse carts, not even the car. So it's not rare to have a street that's only 3 meters wide, and therefore staying 2 meters apart with 3 meter wide streets gets difficult. So towns implemented advisory one-way systems, restricted or banned traffic to give more space for visitors and pedestrians. That worked in most places. The real honeypots, that was more of a challenge, and people were probably pushing the barrier down to 1 meter all too often. And some of the things you've got to look at there is, how do you use technology on advising people ahead of their day or ahead of arrival that actually the town is getting overcrowded? Because once people turn up and they've parked the vehicle or they've arrived at the station, it's very difficult then to get them to go back. So we have got to look at a lot more better information. And some of that is weather related and some of it is time. If you have a glorious hot sunny day on a Sunday, then there are certain places and beaches that will be overcrowded because of local people as well as visitors. So we've got to get better at that bit of communication and information. And that might include, and this is only a might, restricting car parking in certain places so that you take away some of the ability to visit those. But also, like with beaches, you know, we have 80 bathing beaches, but we have over 400 beaches and coves. We have we have 3 or 4 hotspots, but we've got 20 coastal villages, many of whom would welcome a few extra visitors. So our challenge next year will be informing the customer, more about informing the customer of the hidden side of Cornwall, go to the other places of Cornwall, discover other bits of Cornwall, and to ease the pressure on the hotspots.
Thank you very much, Malcolm. That's most helpful. Now, Ignacy, if I can come to you, I've been to see you in Barcelona and I've enjoyed coming to see this wonderful, vibrant city. But you've a reputation for entertaining throngs of young people, exactly what is not possible with COVID-19. And so what have you been doing actually to manage the situation, given the attractiveness of Barcelona in the current context? So what is the current situation, and what have you been doing to make Barcelona COVID secure? Very briefly, thank you. I think you're on mute. Can you? No?
Sorry.
That's
it's
it.
Okay. Yeah. Good morning, good afternoon, good evening, everybody. Thank you for inviting us. It's really a pleasure to share with you all our experiences and our situation. Since March, Barcelona has decreased in the number of tourist arrivals as a consequence of the COVID, of course, which means that we currently have registered over 80% less tourists than in 2019. You can imagine what it represents for a tourist city like Barcelona. Nevertheless, during those 8 months, the situation and perspectives have been constantly changing. After the lockdown, June and July were expected to be the beginning of the recovery. Barcelona started to reopen accommodations and cultural spaces. Google searches for the destinations started to rise and reach almost the numbers of the beginning of the year. However, once the autumn started and the second wave of the pandemic hit Europe, all the perspectives started to moderate and decrease. situating the inflection point of recovery next spring and leaving this winter without the expected recovery. The scheduled flights in Spain is today less 75% compared to 2019, while in August was only 47%. One of the relevant characteristics of our city, as you may know, is that Barcelona is an international tourist destination with a high profile of international tourists. Around 80% of all tourists are international. It means that the COVID-19 effect have been, like in many other European cities, very, very deep. Just to give an example of how are we right now, the number of hotels open in Barcelona are 138, which represents 40% of the total hotel beds in town. Concerning what we have done with to recover the confidence, because as you have all said, this is probably one of our main priorities. As you know, Barcelona has suffered different difficulties and episodes, and especially the 2017 terrorist attack. Barcelona is a resilient city and always responds quickly and efficiently in moments of crisis. And this pandemic has also been a moment to show how the local community works as a team. Let me put some examples of what have been we done. Let me start by mentioning the Hotel Salud project. Hotel Salud is a public-private initiative. 16 hotels of Barcelona offer to the local sanitary authorities more than 2,500 rooms to face and mitigate the pandemic consequences. Hotel Salud project is promoted by the municipality, but also with the collaboration of the Catalan government, Metropolitan Transport authorities, working together for the benefit of residents. Let me also say that we are very proud that the World Travel Market Responsible Tourism Award has recognized this project as one of the most relevant ones. The second initiative is the Barcelona Safe City, Safe Visit. This is a free advice service launched by the municipality based on the characteristics of each establishment and its scope of action. The tool aims to facilitate, to encourage, to stimulate local companies and tourist providers to adopt protocols and safety measures for COVID-19. This is an online service that provide access to mandatory rules, measures and protocols, possibilities of obtaining stamps, accreditations, and certificates, etc. The third one is the biosphere commitment to sustainable tourism. This is a label which recognizes tourist companies in Barcelona who are committed to economic growth based on responsible management that is environmentally friendly and respects culture, working conditions, gender equality, etc. To obtain this label, companies must implement different measures to attain sustainable goals, to fulfill the requirements or the category, to undergo necessary training, to receive expert help from the consultancy firm, etc.
Ignacio,
Yeah.
Can I just interrupt a minute, because obviously we're tight for time. What I wanted just to explore is, have you taken any specific measures, for example, about potential crowds? At the moment, you don't have big crowds because of the reductions in the number of people who are coming to Barcelona. But the measures, for example, to visit Sagrada Familia and places like that, have you taken extra measures to ensure that customers can feel confident that they're not going to get the virus?
Yeah, let me just finish I think it's a very relevant aspect, which is that one of the initiatives that we have done is to adopt the WTTC safe travel label, because this is very relevant, because we think that tourists all over the world, international tourists, don't know the local labels. They know international recognized labels. And this is why we immediately took the possibility that WTTC offer us in order to spread this level in our all companies. And this is what we have done. Even companies and venues and establishment that has an official certified anti-COVID procedure, measures, protocols, use the WTTC label, because this one is an international recognized one. Well, having said that, and trying to answer your question, Martin, the tourist activity has decreased a lot in Barcelona. So I have to say that, of course, we are applying, and all the I would say all the big venues like Sagrada Familia and many others has put restrictions to the visits of tourists. But let me also say that what is important right now is to work for the future. We know that in difficult times, it's difficult to think that this is also an opportunity to focus our attention in strategic aspects. But it is with what we also are doing right now. We think that there are some strategic aspects like sustainability, digitalization, marketing contents, knowledge and market intelligence that can help us in order to manage properly the situation in the near future. These aspects are strategic for the near future.
Yes, no, I understand. That's very, very interesting observation. I hope other cities are doing the same things. Thank you, Nancy. I think that what I'll do now is we'll move to Paul Meyer, who is from the Common Pass Initiative and is focused on safely restoring cross-border travel. Now, I'm sorry to have got you up so early, Paul, in New York, but where have you got to so far in all of your work?
Well, sure, I have a very large cup of coffee, so I'm like I have a few minutes to drink enough of it, so hopefully I'll be coherent. So we launched the first two trials of Common Pass, first with Cathay Pacific between Hong Kong and Singapore, then with United Airlines between London and New York, collaborating obviously with airlines, airports, but also really critically with the government collaborators. So in the U.S., for example, U.S. Customs and Border Protection and CDC. I do want to pick up on something Jeff mentioned. I think there are many challenges facing this sort of the industry, but there's one, traveler confidence, but there's also quarantines and closed borders, and we really need to address both. And so as we think about Common Pass, which really is designed to both give travelers confidence, but also, and more importantly, give governments confidence that they can actually begin to open up and relax quarantine restrictions, we think that's really critical. So where we are now, having launched these first successful trials, now working with many of the largest airlines in the world, but most importantly with governments, and now being included in some of these bilateral conversations about travel bubbles. For example, Hong Kong and Singapore have now announced they're going to be open a travel bubble. To do that, the UK and the US are in dialogue about opening up a travel corridor. There are a number of these bilateral conversations that are ongoing. What we're doing now is participating in many of those dialogues to actually talk about both Common Pass, the platform, but also the underlying common trust framework that supports it, to be incorporated into those dialogues and the policy planning to begin to open up. Because ultimately, it's very difficult for a government to relax a quarantine restriction if they can't have confidence that someone actually got tested. We had a rich discussion earlier around the benefit of testing 3 days before and perhaps on arrival. But if you can't trust that someone actually got tested, or that they can just buy a test certificate or modify a PDF, you can't. It's very difficult as a policymaker to make that decision.
But
So
how do you, let's get to the detail. How is that expected to operate? I mean, I'll give you an illustration of what I have in mind. Let's say that you could go to a pharmacy and you could get it yourself tested there, and you have the result coming through in 5 minutes or so, and they then send all the details which would link to your travel booking and your passport details. Now, the interesting thing about that is that if you're thinking of the terrorism framework, the advanced passenger information is hugely valuable for countries receiving people and to know who they didn't want to have coming into the country. Do you see the possibility of also using that advanced passenger information platform for providing details of this kind relating to COVID pass or fail?
Yeah, we're in active dialogue with various models for integrating into immigration and border control systems now globally. You're absolutely right. But let me just walk through the process. Right? Ultimately, it starts with the lab. And I should say, we're talking about labs right now, but we started this conversation with the very good, promising news that Pfizer has a pretty promising vaccine candidate. We're talking about PCR tests right now. There are new rapid tests that are getting better and better. There will hopefully, soon be vaccines, Pfizer being one of them, but others. The reality is we're going to be dealing with a combination of health data points. There's been a huge push to say, hey, wouldn't it be great if all countries just agreed on PCR tests 72 hours for departure? That's just never going to happen because the pandemic is evolving quickly and the science is evolving quickly. So we can't put our hopes on like one universally adopted testing regime that's all of a sudden going to get everyone to adopt. This is going to be a dynamic, fluid situation. So this sort of trust framework and a process, we shouldn't have to swap out the processes and the systems just because there's a new test or there's a new vaccine or there are multiple vaccines. And so the way the Common Trust Framework and then the Common Pass platform on top of it work is this. First, it starts with who is the source of data. Is it a trusted lab? And we're basically building what we call the Common Trust Health Directory, working with governments to basically say, okay, who are those trusted sources of data in your country for the purposes of outbound travel? That's one element because we need to know, was the lab a reliable lab or not? The way our platform works is then the individual basically gets their record. So we don't send any data. Actually, we don't send any health data across international borders. The individual says, I just got tested at CVS. I'm now pulling my CVS test result onto my phone where I've got control of it. I now want to fly to the UK. What Common Pass is doing is then it's tapping into the other part of the Common Trust Framework, which is a rules registry, which basically says, okay, what are the rules? What are the health screening requirements for entering a jurisdiction? Or could it eventually be entering a hotel, right? What are the rules to go into Radisson? But let's just start with the governments. So what are the rules? And what Compass does is says, okay, we understand what the rules are for entering that jurisdiction. Hey, Paul, show me that you've got a test result that satisfies those rules. If you satisfy those rules, then you basically get a pass, a Common Pass, which you can then show by a QR code, visually inspected, or it can be integrated into airline departure control systems or APIS systems which as a thumbs up or thumbs down. And that's the way to do this in a way that actually preserves individual data privacy, as well as complies with GDPR and other data privacy regimes, because we don't think you should have to hand over your personal health information to an airline or a government just because you want to travel. That said, your fellow travelers and those destinations want confidence that you actually have satisfied whatever requirements they have set out.
Tell me, do you see data protection issues about just having a test and giving the information over? Do you see privacy issues relating to that?
Well, I think I just described how we can actually solve the problem without compromising individuals' data privacies, right? Because ultimately, I've talked to, no airline wants to be holding, individual health data. I'm sure, Radisson Hotels doesn't want all of a sudden be have to either look at or hold individuals' health information. And frankly, even governments don't. And so, but I don't think they have to. They want to know reliably, if we say the rule is you need a PCR test 3 days before departure, did someone actually get that? They want a yes/no answer to that question. They actually don't want the underlying data. So the way we've architected this is we give the airline, the border agency, the hotel, whoever, the answer they need without actually handing over any information, because really they don't want it and they shouldn't have it.
Right. Yes, that's it. Now, if you look at these initiatives, you talked about the ones in the Far East, you've talked about the one New York, London. I mean, when do you think that these will begin to bear fruit? When are we going to see the results of those? And does it depend to some extent on the level or the prevalence of the disease? Do you need it in the community at a low level to start with, or does it just simply not matter?
No, I mean, the whole principle of this kind of a model is it allows governments the flexibility to begin to open up a little bit with people who have basically satisfied, a process to build confidence, right? It's very difficult if you're a policymaker and your choice is all or nothing. Right now, obviously, virus is raging in the United States. If I'm a foreign government, it's very difficult to say, okay, any American can, welcome, open doors. So, but if you say, okay, I'm not gonna open up to anybody, but if someone has actually satisfied this quite rigorous process, I can open up the door a little bit. So, no, I think the whole principle of this is it creates a model to give governments confidence to begin to open up, because they can have faith that people have been through a rigorous process that reduces the risk. I also should say, look, there are no perfect solutions. There's no such thing as kind of COVID-free or immunity or anything else. This is about risk reduction. And really what we're trying to do is demonstrate, a kind of a rigorous, trusted process to give primarily governments, but also, travel and tourism industry stakeholders, the sort of confidence to kind of create sort of safe zones, whether it's a flight where everyone's passed, whether it's a hotel. So no, it doesn't require, us to have overcome the pandemic. The whole point is to create a model that can allow things to begin to open up, even while, the pandemic is still spreading. And I think the final thing I'll say, just because we're going to be in this in-between zone for a long time. I mean, fantastic news from Pfizer yesterday. But it's going to be, months and to years before, a broad critical mass of the world's population has all been vaccinated. And so we're just going to be dealing, unfortunately, with this sort of fuzzy in-between zone for, quite some time to come.
Now, am I right that, because you talked about confidence, that your real focus on this issue of quarantine and also of giving people, countries, confidence that the people who are arriving are not arriving and importing the virus, or because the other side of that is this question of giving people confidence to fly by airplane, which at the moment people are very reluctant to do. Do you see that what you're doing in the Common Pass Initiative is actually helping in any specific ways with giving people confidence to book and travel?
Yeah, look, I think
apart from the importation and obviously getting rid of the quarantine.
Absolutely. We're working with a number of airlines that are planning for what effectively 100% tested flights, right? Even if it's not a requirement, right? That there are airlines, because they want to rebuild confidence. They want to say, hey, everyone on this flight will have been tested through this protocol, right? So I think the answer is absolutely yes. We're doing both. We're both saying, hey, is this a mechanism where you can give confidence that, if I'm going to get on a plane or I go to a hotel, that everybody's been through this process. So we're both working with let's call it the restoring confidence, as well as the, giving government policymakers the confidence to begin to open up and do things like, relaxing quarantines and enabling bubbles. And the final thing I'll say, we're obviously working with some of the, kind of corridors that are being opened up in the bubbles. It is so critical. This is a global solution. The travel industry is a global interconnected system. This model doesn't work. I mean, you can't just set up a bubble, because eventually the bubbles have to connect to other bubbles. The government that really first got very engaged with Common Pass was the government of Japan, who is still very committed to hosting the Olympics next summer. And if you want to host the Olympics, you can't do it with 2 travel bubbles or 2 corridors. That won't, if you only had, athletes and spectators from, I don't know, Singapore and South Korea, that wouldn't make for a great Olympics. And so when you start to think about those kinds of situations, you realize we can't end up with a system that is just, you know, a bubble here, a corridor there. Eventually, those have to connect, which is why we have built something that's effectively a globally interoperable model and framework. It's the only way this model scales to the can meet the global scale and complexity of this challenge.
And lastly, the question, you talked about PCR tests. They look to me, given there are all these other ones coming along, you said it's a very dynamic situation, the PCR tests are going to be seen as very old-fashioned and superseded in due course. I would have thought, with all these saliva tests and other things coming on stream. How are you thinking of managing the changes in the protocols relating to the testing regimes which are acceptable? How is that going to work?
So I should step back. You know, the Commons Project Foundation, which is the nonprofit public trust that has launched, you know, this initiative, you know, we existed, you know, well before COVID, and will exist long before, you know, long after. I mean, our foundational platform is called Common Health, which is a platform, sort of the Android ecosystem's equivalent to Apple Health, that allows individuals to collect and manage their personal health information from various data sources. There's nothing, and all health data, not just lab tests, not just COVID tests, but, you know, any kind of health data. And so we're completely agnostic to data types. And our foundation is empowering individuals to access and control their health information, first and foremost for health purposes. So I look forward to, you know, forgetting everything I've learned in the last 6 months from people like Jeff and others about the travel industry. I've spent my career in health and health data interoperability. And, you know, that is our foundation, that is our core. There's nothing in what we've built that is specific to PCR tests or antigen tests or this kind of vaccine. That it's all tests, it's all health data, and so you do it by being open to all health data and using well-established, proven sort of health data interoperability standards that the healthcare system has developed over years. We're not creating something that's just a travel pass. We're basically building on the foundation of sort of, you know, standards and health data interoperability, so that, and doing that means as new tests come online, as new vaccines come online, those are just new data types that are flowing into the same platform.
Sure. When do you think, more or less, that we're going to see some really concrete examples of things working well as the bubbles between New York and London or Far East? When do you think we're going to see, because at the moment we have good examples, skeptics are then going to begin to diminish?
Well, I think we're, you know, those bubbles are, you know, looking to open up, you know, I roughly in the December timeframe. And then I think we're going to see much broader adoption, you know, beginning from January. We're also working now a lot with some of the, beginning work with some of the sort of, for example, Caribbean destinations, Africa, Middle East, you know, many other regions as well. So I think, you know, I think the way I think about things, we were able to sort of prove the concept in these initial trials, you know, generated, you know, a pretty substantial kind of global attention. We're now, you know, we're now again working with I'd say, you know, most of the largest airlines to build this into their processes, work with governments to think about some of these integration issues with, you know, with the APIS flows and so forth. And I think that, you know, from ideally this sort of holiday travel season, but certainly, you know, kind of the winter travel season is obviously a critical season for the travel and tourism industry, and I think we'll start to see the scale up pretty substantially during that period.
Paul, thank you very much. Inga, just quickly, given what you've now heard, having been as a hotel group and seeing the work which is also happening through WTTC and through Common Path and so on, do you have more confidence that we will have the resilience in the tourism and travel sector than perhaps you had at the start of this discussion?
I'm a positive person, so absolutely. I love this industry, and I think, you know, for the benefit of all the people working in it, for all our wonderful hotels and all the companies in tourism and travel. We must have confidence. We had the good news of Pfizer. We have these initiatives like Common Pass, rapid antigen testing. So things are evolving. And although it's still very hard times in many locations, I think if we have proof in point of many of these technologies that we can open up. Because domestic travel is happening in some locations, like the gentleman from Cornwall was saying, but it's not enough, and we will need to go to opening up tourism again. But I do agree with Ignacio from Barcelona that the recovery needs to be inclusive and green. That's the other hat I'm wearing for Radisson, sustainability. This needs to happen too, because this is our opportunity to reset and have a destination focus on also making the destinations green and all the players in it.
Thank you very much. Now, I see that we're almost up with our time, and therefore we won't be able to go to any further discussions, which is in a way a pity, but at the same time, we've explored people's views and what they had to contribute very strongly. And I want to thank all of you for what you have done today and have made actually a very strong contribution towards this discussion, which will mean to say that the travel and tourism industry is much more resilient in the future. And it looks to me that with the good news we've had from Pfizer yesterday, with this rapid testing arrangements and all the other more detailed work which is going on, that we will be able to give consumers confidence to travel again and also control the issue of importation of the virus into the different countries. So thank you very much indeed. I found it the most rewarding discussion and hope you did too. Thanks very much and goodbye.
Thank you. Goodbye.
Thank you.
Bye.
Bye-bye.